The impact of COVID-19 in Uganda has been quite good and bad at the same time. I'll start with the good. We have seen a lot of digitalization in the country because of the interruptions in the access to healthcare, access to businesses, access to schools. So many of the innovations we've seen in the country have actually been as a result of the pandemic. With regards to the bad, Uganda has actually landed itself a position in the Guinness Book of Records for having the longest closure of schools. Close to 15 million children were out of school for 80 weeks. This in itself has had grave impacts. We've seen about 500,000 girls, teenagers pregnant between 2020 and 2021. This is going to affect the population in the country and most importantly, their life in the future and the young ones that they bring on board. As the course project and as the work stream lead for modeling, I'm happy to say that we have actually made an impact. We've modeled the COVID-19 pandemic and informed the ministry of what, when the third wave would be. We've actually used non-conventional data sets, including Twitter, community radio, voice scripts, and chatbots to inform myths around COVID-19, to understand how mobility have been affected because of COVID-19. And this information is going to be very critical as the country designs future strategies to control COVID-19 and future epidemics, because the way data is being used in the country and many parts of the world, we see that data is going to be very critical in terms of making informed and empirical based decisions to control the pandemic in Uganda.